Ladies and gentlemen, Your Excellencies, welcome to the Swiss Healthcare Innovation Day. I'm Johanna Stralla, a journalist with Estonian Public Broadcasting, and I'm honored to guide you through today's conversations. Now, we have a room full of people who shape the healthcare sector from every angle. We have policy leaders, hospital managers, digital health experts, and innovators. And that is exactly what we need, because the challenges that we're facing today won't be solved by one stakeholder alone. Nevertheless, it's hard to ignore the contrast and irony between our surroundings and the topic that we're discussing today. This Baroque palace with all its beauty, history, and art reminds us what wealth once looked like. And in this luxury setting, we'll be discussing, well, in a way, how to do more with less, but definitely how to use our resources better. Ladies and gentlemen, you all know the numbers. People are living longer and need more care. The workforce, at the same time, is shrinking. Healthcare costs are growing faster than tax revenues. In Estonia, our health insurance fund is already in deficit. By 2040, that gap could reach over €1 billion if nothing changes. And Estonia, of course, is not alone with this challenge. But dear friends, we're not here to repeat the problems. We're here to hopefully ask better questions. What if innovation and healthcare could not only improve outcomes, but also drive economic growth and resilience? Today we'll tackle that idea from several angles. How can we actually use the data that we collect to improve outcomes and decision-making? And in Estonia, we have a lot of data. Our systems are very digital. Can we actually use this data to improve our health policy? Now, what does real public-private collaboration look like beyond a few successful pilot projects that we've also had in Estonia? And how do we shift from reactive systems to smarter and more sustainable health models? Because in the end, healthcare doesn't only have to be a cost. It's not just a cost. It's one of the most important investments a society can make in people, in productivity, and in long-term stability. Now, a quick note before we begin. If you'd like to join in the conversation, please take out your smartphone and go to a web address, slido.com. Now, when you enter the password SwissInno, or you can also scan the QR code which you see on the display, you can ask questions throughout the day. Those questions will magically appear on a screen in front of the stage, and then I can take them to the panelists. Ladies and gentlemen, to officially open the day, I'm very pleased to welcome someone who has helped build bridges between Estonia and Switzerland, and whose support has made this event possible. Please welcome Mr. Martin Michelet, the Swiss ambassador to Estonia.
Honorable Minister, dear Dr. Colombier, distinguished guests and friends, I'm truly honored, and it's a great pleasure for me to welcome you to the third Swiss Healthcare Innovation Day, this time in beautiful Tallinn, Estonia, in this magnificent venue. Roche and Novartis, two leading innovative Swiss-based healthcare and pharmaceutical companies, are our partner for this event, and I would like to extend my sincere thanks for their partnership and to all the colleagues involved in the practical organization of today's event and for their support. As I mentioned, this is already the third edition of the Swiss Healthcare Innovation Day. When we hosted the inaugural event in Riga, I had just only started my tenure as Swiss ambassador to Estonia to Latvia and to Lithuania. And as we gather today, 1 year after the event in Vilnius, it's already the third edition and in a way my farewell event, a personal milestone for me, and I'm really glad and proud of this journey made with all of you and with the colleagues at the embassy and at Roche and Novartis. A lot can and has happened over the course of 3 years. We've explored how breakthrough innovation can be adopted early and brought to patients. We have delved into digital health, and we have examined development in biotechnology. This year, our focus turns to health and economics. How can healthcare policies support economic growth? How can data and AI ecosystem not only enhance health outcomes, but also strengthen economic ambition? The insights we gain today will be relevant in Estonia and in Switzerland alike, and I am certain that they will also be of interest to our Latvian and Lithuanian friends. Warm greeting to everyone joining us online. While the topics have changed, the main focus on innovation remains. Switzerland is often topping international competitiveness and innovation rankings, and I do believe that makes my country a strong and attractive partner in Europe. As for this event, it has almost become an unofficially official slogan: innovation saves not only lives, but also money. And this is relevant for every country and for every government, especially nowadays. This year, we are pleased to welcome Dr. Carsten Colombier from the Swiss Federal Finance Administration, who will share insight on how improved healthcare outcomes contribute to economic growth. Ladies and gentlemen, it's a true pleasure to see so many of you here in this beautiful Kadriorg Palace. I look forward to a day filled with enriching, actionable dialogue and collaboration. Thank you for being here, and thank you for your attention. I wish you a productive and inspiring day ahead. Thank you for your attention.
Thank you, Mr. Ambassador, and what a modest farewell event you have organized, indeed. It's a pleasure to be part of it. Now, we often hear that health and economy are in separate conversations, right? So, but in reality, actually, are they very deeply connected? A healthy population is obviously a productive one, and good healthcare policy is, in a way, economic policy. And yet many countries, including Estonia, still treat healthcare primarily as a cost. Financing is fragmented, innovation is often underfunded, and while long-term sustainability, if you look at the prognosis, not really looking good. So today we ask, are our current health and economic policies actually working together, or are they in separate silos? And what can we learn from countries like Switzerland? To explore this, I'm delighted to welcome someone who brings deep insight into the financial side of the healthcare systems and who can help us to see a bigger picture. Please welcome Dr. Carsten Colombier, Economic Advisor at the Federal Department of Finance in Switzerland.
Ladies and gentlemen, I feel very honored to be invited as a speaker to this very well-known event in the meantime. And I just want to talk a little bit about the macroeconomic perspective on health economics. So it's a bird's eye view that I take. I just say it in front of my speech. Now, first of all, let us look at the goals for a health system, which are formulated by the World Health Organization. It's about the improvement of the population's health condition, and in particular, it's about equal access to healthcare and also universal coverage. And that's for sure, it should be focused on the needs of the whole population. However, usually regulatory rules follow intermediate goals that are more concrete than the overall goals of the WHO, excuse me. This is the equity. This deals about equal access for the whole population to healthcare services, about the quality of healthcare service, and in particular, from an economic point of view, important is the efficiency of the health system. It's about the organization of the health system. And what is relevant for the public finances, for the public budget, but also for the social health insurances is fiscal sustainability. Thus, in the long time, healthcare services should be financeable. And last but not least, since the COVID-19 pandemics, a new criterion has come up. It's resilience of the healthcare systems, that at all times shortages should be avoided in a health system. This is also of utmost importance as well, but I do not go into detail with respect to the resilience aspect. And now, let us talk a little bit about the economic basics for the high regulation, for the heavy regulation we have in healthcare. And the most important point is that health is viewed as a key to equal opportunities in a society. If somebody does not have good health, then it is difficult to develop his own personality, his own career, and he cannot be or she cannot be successful in the labor market. This is very important. And a very important insight of health economics is the fact that we have a merit good. So the social benefits are much more important than the costs, than the social costs of healthcare, of health services. And from an economist's point of view, we have a fear due to market failures in the system that we have an under-provision of healthcare services, and this is the reason why the government is so heavily, or does so heavily intervene in healthcare, in the healthcare sector. So health is a basic need, and that is key to our well-being. And what is also important for the growth, for the possibly growth-enhancing impact of healthcare, is the fact that health is viewed as an important element, as I said already, for the development of a personal career, of an individual career in the labor market, is human capital accumulation. It's an element of human capital accumulation. Now let us first start with the cost side, which maybe most of you are familiar with. It's the development of healthcare expenditure in terms of GDP. And here in this figure, I have made a comparison between selected European countries and Estonia. It is shown the ratio of healthcare expenditure in terms of GDP from 2000 to 2022. And what we can observe is the fact that in all countries, healthcare is rising in terms of national income. So it becomes ever more expensive in terms of GDP. A rising share of our national income, of our aggregated income, is devoted to healthcare in all of our societies. Now, if we have a look at the Estonian case, which might be of most interest to you, this is a solid red line shown in the slide. You can see that we start from a very low position, from a very low level in terms of GDP. It's about 5% in 2000. But we also see that we have an increasing trend there. But still, also in 2022, the level compared to developed European countries, such as Switzerland, Denmark, or Germany, for example, is very huge. We have a very huge gap. So there's still a lot of potential. Now, what are the most important drivers of this development? One of them, for sure, that you all know, I don't tell you something really new about this, is population aging. And here in this slide, we can document why population aging is an important driver of healthcare expenditure. And we show here a projection by Eurostat for some European countries, selected European countries, and also the Estonian case for the projection period from 2022 to 2070. And what we can see here is the ratio, the old age dependency ratio, the ratio between the people aged 65 years old and older to the working age population. That is a relevant indicator for the pressure from population aging on healthcare expenditure. And the solid red line shows here that the Estonian population will be aging very fast until 2060. And this is a rather long time. Because in other countries, for example, we have, due to the baby boomer generation, we have only an increase or a higher speed of, an accelerated speed of aging until the mid of the 2030s. So that's a huge difference. So it seems to be that population aging is a more important problem, even a more important problem than in other European countries. Now, another point is, which has also the first speaker touched upon, the moderator has touched upon, is the relationship between an increasing life expectancy and the health condition of the population. So this is a very important point, and usually one differentiates between different hypotheses on this issue. There are competing hypotheses. Pure aging, if the population gets older, does it get older in a healthy condition or not? And if it gets older in a healthy condition, such as is believed by the people who support the healthy aging hypothesis, then it also mitigates the cost growth of healthcare services. Now, unfortunately, the empirical evidence is mixed on this issue. So we don't have a clear-cut picture with regard to the different hypotheses on longevity. But we know if the people get older, healthier, then it's better for healthcare expenditure. So these costs can be contained if the population gets older in a healthy condition. Now, let us skip to other factors that might impact the growth of healthcare expenditure. Here we have a multitude of economic factors. First and foremost, there's the income growth, because if a society gets richer, then the demand for healthcare services is growing. On the other hand, also the purchasing power parity of the population or of a society is growing in such a society, and as a result of this, medical innovations become more attractive. The markets grow for medical innovation in such countries. Now, medical progress itself is also a cost driver. Also, it is also highly beneficial for the health of the population. It's also a cost driver on the other hand. I will come back to this point later on. And what is also important in healthcare, it's a labor-intensive service. And as a result of this, it has a slow productivity growth, and this leads to a relative price effect. This means that inflation in healthcare is higher than overall inflation. And this phenomenon is called almost cost disease. And secondly, because of population aging, we will envisage labor market shortages, in particular for doctors and nurses as well, in many countries. So, and there are other effects as well. There are also political and institutional factors. Why is this the case? I also want to emphasize only one point. We have in healthcare, it's a very complex system, and we have a lot of groups with vested interest in this system. In particular, the Providers Association are small groups, and they are very homogeneous groups. And because of this reason, they have much political power. So they can influence political decisions. This is also true, for example, for the pharmaceutical industry or for the medical device industry as well. And therefore, we have also what is called in economics regulatory capture, because usually we have a kind of revolving door effect. The people who work for the regulatory of the government has before worked maybe in the industry that is regulated, and therefore we have this impact that the interest of the industry are much more higher evaluated than the interest of the population of the country. This might be the case. And there are other political and institutional factors as well, but I don't have the time to go into detail with respect of the other factors here, re-election motives of politicians as well. It is difficult to shut down, for example, hospitals. It's not very popular among the population to shut down hospitals, that's for sure. So, and also other points here. And now I come to the main theme of this event. It's about the relationship between the healthcare sector and economic growth. And as I already said, medical innovation is a very important factor also for economic growth, because it does support the health status or the health condition of the population. And as a macroeconomics, we usually discern between two kinds of innovations. On the one hand, we have process or organizational innovations. What does it mean? It means that we can produce the same level of output, with less inputs, with less resources. This is output efficiency. This is the healthcare output. And the healthcare output is about the quantity dimension. So, for example, for the number of treatments, it's the number of hospital admissions, it's the number of doctor's visits, for example. So this is about health output. So the quantity of health services, and if we have an increase in output efficiency, this would mean we have an increase in productivity growth of the healthcare sector, because the added value of the healthcare sector is increased in this case. But the second dimension of the healthcare sector is special, and this makes a difference, for example, to the production of mobile phones, to the production of televisions, to the production of cars. We have a quality dimension here, which is much more important than the output dimension, and this is about health outcomes. And health outcomes the health outcome of the population, which is usually measured by an indicator for the mortality or for the morbidity rate of the population, is influenced by many factors. And one of these many factors is the healthcare system or are the healthcare services. Others may be, for example, a healthy lifestyle, maybe, for example, the environment where we live in, maybe, for example, the work conditions under which we have to work. So there are really many, many factors. So an increase in outcome efficiency would mean that we have an improvement of health outcomes with the same resources, or we have a stable level of health outcomes with less resources. This would mean an improvement in outcome efficiency. Now let's go to medical innovations, as I told you already. So we have a process or organizational innovations, and this is about output efficiency. So process innovations lead to an increase in the best case, to an increase of output efficiency, an increase in productivity growth. This can contribute to the overall productivity growth of an economy. Secondly, and this is the predominant kind of innovations in healthcare, these are product innovations. And in the best case, these innovations are effective on the one hand and are cost efficient on the other hand. So this would mean an increase in the health outcome of the population and in outcome efficiency. And as we will see later on, that this will also increase economic growth. So what what are the health policies that could foster medical innovations? At this point, I can only provide a bird's eye perspective, very general view. I cannot delve into the microeconomic sphere here because I don't have the time. First of all, it is of utmost importance to introduce, to implement an effective health technology assessment. This is decisive because otherwise you would adopt technologies which are in the worst case not effective and on the other hand also cost inefficient at the same time. And that would not bring about an increase in health, in output, in outcome efficiency. Secondly, one should promote incentives for process or organizational innovations, for example, by implementing integrated care. This would help to reduce treatments that are repeated, the same treatments that are repeated by different providers, for example, general practitioners and specialists at the same time. This would help. And moreover, demand management might be also important, but I don't touch upon this point. And another fact is Bormund's growth disease. This has also a bearing on the productivity of the health sector itself. Because this results from Bormund's cause disease, which I talked about earlier. And due to the fact that the healthcare sector overall is a very labor-intensive sector, we have slow productivity growth, and healthcare sector is a typical epitomizes a labor-intensive service. And according to Bormund's hypotheses, the labor-intensive service has assumed a growing share in GDP over a longer time. And so if the whole economy, if an ever-growing part of the value added comes from personal intensive services, then the productivity of the overall economy slows down. So we have, due to the shift, to the structural shift of nominal GDP to labor-intensive services, we have a slowdown in productivity growth. And this can also come from the healthcare sector as well. So the healthcare sector can also contribute to a slowing down of the productivity growth of the whole economy. So health policies. We should improve the measurement of healthcare services. We have all around, we have measurement problems in healthcare because we cannot discern properly between prices and amounts. What does it mean for productivity growth? We cannot measure productivity growth really decently well. So it's not very exact. So what would also help non-wage incentives for health workers, and we should improve the labor market outcome through an increase in health outcomes. So an improvement in health outcomes is also very crucial for serving the aim that the healthcare sector can contribute positively and to an important size for productivity growth. So the improvement in healthcare outcomes supports the accumulation of human capital, and this would support productivity growth of the overall economy. Moreover, it would help to raise or to increase labor productivity growth and also the labor participation rates. All those channels would help to accelerate the overall economic growth of an economy. And empirical evidence confirms this channel. It confirms the fact that indeed a better health outcome leads to higher economic growth. And what is not clear, because we have, as I said, a multitude of factors that influence the health outcome of the population, healthcare spending itself can also help to improve health outcomes and thus economic growth. Now, this brings me to the concluding part of my presentation. First of all, we have continuous cost pressure. This means that we have to unlock efficiency potentials of our system, that we should optimize the allocation of resources between different healthcare sectors, subsectors of healthcare, such as outpatient versus inpatient care, and we should promote preventive care. Moreover, health policy can positively affect economic growth through the labor market channel, as I already pointed out, and therefore health measures can be viewed as strategic investment that can themselves support cost mitigation of the health system. And from my point of view, as many factors increase the health outcome of the populations, all policy of the government, all measures of the government should also be assessed by the criterion of their health impact as well. Because also environmental policies, occupational policies, for example, educational policies have a bearing on health outcome as well, and this is also confirmed by the empirical literature in health economics. So last but not least, I haven't talked about the labor market shortages in healthcare, which is also a very crucial point for the development of the health systems in the future and for their good performance as well. Ladies and gentlemen, I thank you for your attention, and I'm looking forward to questions and comments from you, from the audience.
Thank you very much. Indeed, we have already received 2 questions, so let's start with the first one, something that you kind of answered, but I'm still going to ask that. So could you please elaborate why the Ministry of Finance has developed a department for healthcare analytics? What is your department's contribution to the healthcare policy?
So from our point of view, the sustainability of the health system, the fiscal sustainability of the health system is important. And so we are mainly occupied with the cost side of the health sector. And that is the reason why the Ministry of Finance is involved in healthcare analytics. And it's particularly important because a part of the Swiss healthcare system is financed by public finance, by the taxpayers. And this is the reason why we are involved.
Sounds perfectly reasonable. Now, how to select correct and find meaningful indicators for healthcare outcome measures and incentivize their clinical recognition and adoption?
Oh, this is a quite general question. Regarding the indicators, I think the OECD has developed really some very good indicators on this issue, such as, for example, the avoidable mortality rate. Also, there's also an indicator which tells you something about the unmet needs of a health system, which are indicator where you can, from this indicator show how well the healthcare system performs. And I think there are some indicators already around from which you can gauge how you can assess your health system.
Rauno asks, what is the reason behind the decline in health spending in 2022 seen in several countries?
I think it's the effect of the pandemic, because during the pandemic, healthcare expenditure have increased, and as a result of this, after the pandemic, there was a normalization of healthcare spending, so to say. This is the reason.
And the last question, Estonia has a new government. One of our new ministers is about to step on the stage. What is the one recommendation for the government to prioritize regarding the interrelationship between healthcare and the economy?
I think one of the most priorities would be to focus on health outcome in particular, because in Estonia you have still comparatively low level of healthcare expenditure in terms of GDP from my point of view, and therefore I would prioritize focus on health outcomes. So make the health system more that you should increase the health performance on the one hand, on the other hand you should also look for measures to improve the health efficiency of the system.
Well, more questions are coming in. I'm afraid you can't leave the stage quite yet.
Okay.
We still have a few minutes left. So how has Switzerland balanced private incentives and societal goals?
In the healthcare sector?
In the healthcare sector, yeah.
It's difficult. That's a quite challenging question. But I think in the healthcare system, the healthcare system is very complex, and you try to merge on the one hand, private incentives with governmental regulation. And how we have managed, that's difficult. We have, on the one hand, providers have very much leeway in Switzerland. I think, and this is good for the incentives of the providers in Switzerland, for example, for general practitioners or specialists in the ambulatory care sector on the one hand. However, there are also disincentives or wrong incentives that leads to too high spending, to inefficiencies in the system at the same time. So there are positive incentives and negative incentives at the same time.
It seems we have one last question. What has brought most success in your work towards Swiss healthcare systems?
I think to make the cost development and the reasons behind it, the structural factors which bring about the continuously growth in healthcare expenditure more transparent.
Thank you very much.
You're welcome.
For a great presentation. Thank you.